Menstruation is a natural biological process in females where the uterus sheds its lining, resulting in vaginal bleeding. And also, menstruation is a woman's monthly normal vaginal bleeding is called period. When a baby girl is born, her ovaries contain thousands of eggs which stay inactive until puberty begins. There isn't one right age for a girl to get her period, but most girls get their first period starts between age of 10 to 15, but it's different. Every girl's body has its own schedule. The typical length of time between the first day of one period and the first day of the next is 21 to 45 days in young women. In adults, the range in between 21 and 35 days, with the average often cited as 28 days. Bleeding typically lasts 2 to 7 days. Two structures in the brain, the pituitary gland and the hypothalamus, produce complex hormones that stimulates the ovaries to make female sex hormone starts and control the menstrual cycle, and it will continue to about age 50. The menstrual cycle has four phases: menstrual phase, follicle phase, ovulatory phase, and luteal phase. These phases involve the shedding of the uterine lining, the development of follicle in the ovary, the release of an egg called ovulation, and the preparation of the uterus for potential implantation of a fertilized egg. The first phase is menstrual phase. It is when menstruation occurs, typically lasting 3 to 7 days. The uterine lining that was built up in the previous cycle is shed, resulting menstrual bleeding. The second phase is follicular phase. This phase begins with the start of menstruation and continues until ovulation. During this phase, the pituitary gland releases follicle-stimulating hormones called FSH, which stimulates the ovaries to develop follicles. Third one is ovulatory phase. This phase occurs in the middle of the cycle, around day 14 in a 28-day cycle. A surge in luteinizing hormone called LH triggers the release of a mature egg from one of the ovaries, a process called ovulation. Fourth one is luteal phase. After ovulation, the ruptured follicle develops into a structure called the corpus luteum, which produces hormones estrogen and progesterone to prepare the uterine lining for a potential pregnancy. If fertilization does not occur, the corpus luteum shrinks, hormone levels drop, and the cycle begins again with menstruation. The pituitary gland releases hormone called FSH. This hormone causes one fluid-filled follicle contains a mature egg to develop. The maturing follicle produces the hormone called estrogen, which increases over and peaks in about a day 12 and causes the lining of the uterine called endometrium to become thicker and more enriched with blood vessels. In fact, the woman's body prepared to get pregnant. On about day 14, the high amount of LH and FSH causes the egg to be released from the follicle. After release, the egg enters the fallopian tube. The tiny hairs in the tube lining help push it down the narrow pathway toward the uterus. If the sperm cell can successfully meet an egg cell in the fallopian tube, the fertilization will take place. Here, once the egg is released, the follicle seals over. If egg is not fertilized after 24 hours, if the egg is not fertilized by a sperm, the level of estrogen and progesterone hormones begin to drop. The drop in hormones signals the uterine lining to break down and detach from uterine wall. This detached lining, along with blood and other fluid, is expelled from the body through the vagina as menstrual flow, which is commonly known as period. The shedding of the uterine lining is the beginning of a new menstrual cycle, and the process of hormonal preparation, ovulation, and the potential shedding repeats each month if pregnancy does not occur. Besides bleeding from the vagina, you may have abdominal or pelvic cramping pain, or lower back pain, or headache, fatigue, mood swings and irritability, food cravings, bloating, and sore breaths. Thank you for watching and subscribe for more.